We are here again with Dr. Holly Geyer, who is an internal medicine and addiction medicine specialist. She is a national speaker on the topics of opioids and addiction and has authored over 120 publications. She is the author of the leading patient-focused book, Ending the Crisis, Mayo Clinic's Guide to Opioid Addiction and Safe Opioid Use. Appreciate you being here.
So glad to be here, Kim. Thank you.
Yeah, today we're going to be talking about finding and screening a treatment program, something that was an issue for my wife and I in dealing with our sons, and honestly, a very difficult one. It was really hard to know, what to do, where to go, and who to trust. And so in this episode, we're going to be talking about the different types of treatment environments one may encounter along their addiction journey and how to find the one that's right for you. So maybe we could just start off by talking about what environments are used.
Kim, I promise you, if this was an easy thing for families to navigate, we wouldn't have a crisis. We're in the thick of a drug epidemic right now, and in part, it's because people have tremendous problems navigating this system. To start off, as we talk about more of the holistic approach to healthcare, which is the biopsychosocial spiritual treatment approach when it comes to addiction treatment, it can be given in a variety of settings, and that's what we're going to focus on today. What I would say to the average person listening is that one way to think about it might be the inpatient or more intensive approach versus the outpatient, which is perhaps a little bit less intensive, all the way down to the clinic setting, which can be much easier for people to get in and out of.
So a lot of people have maybe not as significant of an issue. Maybe they're not using extremely hardcore, drugs, but they've started to have some issues and consequences and some problems, and they're finally seeking out help. So, where's usually the first line of defense when you don't have necessarily a really maybe what you would consider a significant issue, but it's starting to get there?
Absolutely. In a credit to medicine, I would say there's an app for that. We're able to score using standardized scoring tools the severity of addiction. And that's one of the best ways that we can help identify what's the best treatment environment for a person. That, along in conjunction with something called the American Society of Addiction Medicine Level of Care Assessment, is a great way to identify where we're going to put someone when they start needing help. Now, I would say for most people, especially with low to medium severity addiction, and especially those people who come from that chronic exposure pathway, it might be as easy as working with a primary care provider. Like I said, with opioid use disorder, many primary care providers can offer buprenorphine. They access the medication through that person and then get referred out to counseling or a social worker to get all the psychological and the social issues addressed. I would definitely recommend integrating that spiritual component as well, a pastor, a priest, or a rabbi to help with those issues to get the whole package. That's very different than kind of the middle of the road option, which is an actual treatment program. Those are locations where a person would go in an outpatient setting, typically a couple times a week. And for those who need more intensive therapy, to an inpatient environment where you actually go to live, where all these elements can essentially be addressed simultaneously, and then we can monitor the person in it closely.
And so what's a typical length of treatment if somebody is getting started in this?
Boy, it depends on a lot of factors. I wouldn't reckon to guess for the average person, and unfortunately, insurance companies tend to guide most of that decision making, independent of the needs of the patient. I would say for many, there are a lot of things that come into play. How they're doing through the program. Are they making progress? What kind of standards are at the beginning of the program? Like I said, episode of care relapse. And other factors. So it's a bit hard to guess. We see a lot of 3-month treatments being offered from an insurance standpoint, so I would say that's pretty fair to at least begin the process. For many, that's going to underserve them and they need much longer treatments.
Yeah, and so clearly going above and beyond, what's typical maybe from your insurance. And of course, a lot of that's changing now as people are getting more and more understanding about this issue and what needs to be done.
Absolutely. I think it's key that people work with their insurance industry and identify what options are available to them, and then have open conversations with the provider to make sure that if indications have changed, those are looked into and addressed at each office visit, which could change the way insurance will approach the topic for coverage.
So, when put into practice, what would you say are the hallmark processes of a reputable treatment program?
I tell you, Kim, these are worth screening for. At a minimum, I would look for the following. And the first one, make sure that you're going for a program for a full chemical dependency assessment. You're going to want this performed by someone that's a licensed professional in the field. That means certification. They'll probably give you a very different purview or review of your situation than someone who's not necessarily got the formal experience of doing the scoring tool. The second thing is that everyone should have a comprehensive mental health evaluation. You're going to be looking for these other drivers that could compromise addiction treatment. And so in most cases, this is included in the chemical dependency assessment, but I'm familiar with many, many treatment programs, often which are less than reputable, that just have an intake form that says, do you have bipolar disorder? Do you have schizophrenia? Do you have, depression? You as a patient checking that box is not an assessment, so run for the hills. The other thing, make sure that this program is addressing those biological drivers. Do they have a psychiatrist or addiction specialist on the organizational staff, or do they at least outsource for that? This is going to be essential. Like we've talked about in other episodes, more than 90% of people who don't receive these medications in opioid use disorder in moderate to severe disease will end up having a relapse very soon, typically within 30 days. And then finally, I'd find out exactly what treatment services are being provided in-house by that facility versus which ones they're going to outsource. These fees can add up really quickly, and we see this not uncommonly in residential treatment facilities. Sure, you can go to them and essentially get, billed for group rate housing or living on the facility, but if they're going to send you out to a psychiatrist, you're getting billed there. If they send you out to a counselor, you're going to get billed there. This adds up, so you don't want double or triple billing.
So treatment plans clearly should be individual. And so, how do they, assess the progress and, what about things like, relapse and all of that? What do you look for in a treatment program?
Kim, you're asking the right questions. And I think you brought up in your first statement that it is key to make sure that they are individualized. Every person coming into a treatment program has their own background, their own usage patterns that need to be reviewed. And so ask that question. How are you designing that treatment program? How do I know my loved one's making it to the next step or the next level or getting closer to being released? Also ask about their relapse policies. I am familiar with treatment programs that one-time use is the end of it, and that's a potential overdose waiting to happen. We recognize this as a relapsing disorder, and so more liberal policies to get that person back into recovery I think is so key. I'd also ask whether or not they have licensed therapists there. If the program itself is licensed, you're probably in good hands. But we know that drug and alcohol counseling, family counseling, really the whole field is something that's recognized as a scientific study. And these people learn scientific principles to employ them such that we have best outcomes. You're going to want those being delivered to your loved one. And then I feel the same way about social and spiritual treatment services. In fact, the data would support it. So how are these being integrated in? Is there an aftercare program? Do people get to go to group meetings when they're done? And what kind of family engagement is even allowed during the program so that you can build these up so a person leaves much healthier from a relational aspect?
So essentially realizing that, this affects the entire family. This affects their entire support system, and they need to be a part of whatever is going on here. Is that what you're saying?
Absolutely. You've probably heard that it takes a village, and I've been surprised at how many drug and alcohol treatment programs put the word village in their opening statements or in their title even. We know that this is a biological, psychological, social, and spiritual disorder. It affects all domains, so why wouldn't we treat it as such, and building up relationships is part of that.
And to reiterate, when you see these programs that really are not offering that holistic approach, and they really are just, having individuals come in the door and, maybe just, providing medication or something like that, and then really not even helping them past that, any thoughts? Because it just seems pretty obvious that they're probably not really looking at this from the big picture.
I'll be honest, Kim, the field is lucrative. right? The whole treatment industry can be hundreds of thousands of dollars over a period of a couple months of treatment. And many of the elements that they claim are incorporated in offering that holistic model with tremendous benefit aren't necessarily panning out from that aspect in the literature. I don't really envy anyone who's trying to navigate the substance abuse treatment field right now. Here in the state of Arizona, we've got $150 million Medicaid fraud related to sober living facilities, sober living homes, treatment facilities. It's a mess. And so with that, I would say that knowing what a good treatment program is before you get into it is going to be key to avoiding the pitfalls of this industry. When you know what quality elements of care are, you can screen for them. You can ask for them. And I have a couple words of advice, I guess, about how to go about this process.
So go ahead. Just let us know if you're walking in and trying to understand this. I know as a parent, I didn't really know anything about it. And I remember, they told me things that sounded reasonable, but unfortunately, we were also involved in some situations where it turned out they really weren't providing the services that they said they would.
Kim, there's a huge number of fraudulent treatment philosophies and fraudulent treatment programs across the nation. They're operating in virtually every state. And I don't blame patients or families for not understanding it, because they assume that, very much like the other parts of our healthcare world, like a hospital system, that it's under different forms of regulation. You go in for a heart attack, you can pretty much guarantee that when you get to that hospital, the CMS programs, the Leapfrog programs, JCO, and all these other regulatory organizations are reviewing that hospital regularly, making sure that standards of care are employed. The state medical board is reviewing it. All of these safeguards that we just don't see in the addiction treatment field. There are almost minimal to no standards on how addiction treatment is defined regularly in these programs, and how they're required to operate from a third-party perspective. I would say in general, licensed programs are more likely to incorporate standards of care than non-licensed programs, and even in some cases, the federal government can offer certification, like an opioid treatment program status, for certain treatment services. Keep in mind, many treatment programs are non-licensed everywhere you go. I can give you 20 names right now. It doesn't mean that they don't incorporate standards of care, and it doesn't mean that they do. Please screen. Please screen. One way that you might want to look up whether or not a program is legit or offers good treatment services is through your state health department. Usually they're listed there. And then you can go to findtreatment.gov, which is the federal listing of all these programs. I would recommend you compare these listings to your insurance companies. Sometimes they're just not covered.
Yeah, and one of the things that I've noticed is there's a lot of programs out there who, really tout their success rates. And you look at it and you start looking into the fine print and you start questioning, do they really have outcomes? Do they really have the ability to make those very bold claims?
Well, Kim, there's only three kind of lies out there, right? There's white lies, there's black lies, and there's statistics. Keep in mind, many programs aren't monitoring or even publicly releasing outcomes that they do. Anything that puts them at odds with another program down the street is a paycheck that goes somewhere else, right? And so I would use tremendous caution for the average person that's looking into treatment programs that incredible outcomes may not necessarily mean what they claim to mean. The devil's in the details. We've talked about this a second ago, but having a spa or horseback riding in the backyard or a really nice beach view by no means offers superior outcomes to the average patient than getting standard of care. And so don't get sucked into this overwhelming over-advertising that we see in the industry that suggests that these non-standardized elements are the key to sobriety. As you talked about, how do we look into outcomes? Another problem is there's no standard way that we're reporting these in the industry. Is 6 months of being sober out of the program versus 1 year the best way? Some programs say, we have a 90% sobriety. Well, at 30 days, at 30 years, they don't report that oftentimes. And how they even define sober can be very different. I've seen some programs say that regular drug use is considered someone who's not sober versus any relapse at all. Ask these questions. And another thing I would say is offer a tremendous word of caution that extraordinary program rates and fees aren't necessarily tied to these incredible outcomes. You could have a primary care provider and a counselor offer the same success rates as going to a place that's $10,000 a week. So don't be afraid to ask those hard questions. What do you offer? What's included? What are your success rates? Literally item by item. Do you even assess them? And what are your dropout rates too? We see a lot of dropouts, especially early in treatment, and that's not a success rate, right? But they certainly don't count them in those types of numbers. It's people that graduate the program usually. So lots of things to consider.
So any final thoughts on this particular topic?
Kim, if it's hard for you and me to navigate this, imagine struggling with addiction. Imagine having a brain that's rewired and your neurotransmitters shot and you're strung out, you don't have a phone, you don't have a computer, your mom kicked you out of the house. I mean, all of the distressors in life. Are you going to figure out this industry? I would say to the average family, be the help they need it when they need it most. If you can do a lot of this homework behind the scene, it could be what saves their life. Don't get caught up in the industry scandals. We remember, drug treatment is minimally regulated and it's lucrative. Follow with those programs with a good reputation and go to reputable sites to find them. And keep in mind, I would say this, especially to people who get the best information from word of mouth from friends and family on where to go. It doesn't mean because it worked for one person, it's going to work for another, right? And it may not work for this person or your loved one because it didn't offer standard of care. Ask those right questions right from the beginning.
And as we wrap this up, we'll talk more later about when to do things like an intervention, or if those are even helpful, or other ways to be a support as a family with someone. And clearly, if you can help when they are looking for the help, they're asking for the help, you want to do that. As a family, we wanted to do that. But then, of course, at some point, realizing that if somebody's not willing, or they, simply, like when our son was an adult and just refused to go, we had those things in our pocket.
Yep.
We provided it, but then we had to be very careful about not being so positive that it would work out, that we would just be continually disappointed, because I can't tell you how many times we got in the car and we were on the way and he told us to stop the car and let him out. And so it just became so difficult. But at the same time, again, if somebody's wanting and looking for treatment, this is really where we want to come in and try and get them there, because without treatment, what are we looking at?
Kim, in 2023 and beyond, with fentanyl being the predominant drug, it could be a funeral. You don't want to go there. You want to be prepared for that moment when they say, yes, Dad, I'm ready. Yes, take that moment, because that's the next phone call that you've made that you're prepared for from an insurance standpoint, the drug treatment program, when they're available, how to get them there, and you pack a bag. I would say that the moment you see someone with a window of opportunity, you take that window. And if someone's not open to it, if that window is shut, be in the background. The persistent knocking is helpful. The forcing the window open will kill you as a loved one and consume your life. You don't want to live that way either. And I think in another section, we're going to go into the concepts of codependency and really setting yourself up for failure if you're constantly the answer to their problems instead of offering the solutions instead.
Thank you so much. This is a difficult situation to have to deal with, and most people really don't understand it. So thank you for taking the time to really get into some of the details behind what's going on and how to find an appropriate treatment program. Thank you.
Happy to help, Kim.